Hello, everyone. I'm Dr. Sri Banerjee, epidemiologist, biostatistician, faculty member. And in this segment, I'm going to be going over the opioid epidemic crisis. So let's go ahead and get started. So let's take a look at facts. Now, just to give you a brief overview, while a lot of people criticize the individual that has undergone the opioid overdose, and a lot of people blame them, say that this is their prerogative and their choice to overdose on opioids. However, in public health, we believe in a collective understanding and believe in trying to address things before they happen. And a lot of it is treatment. And so this has been something, naloxone is a lifesaver. And on a population level, there's actually, similar to a needle exchange program, there's actually naloxone that is available in various places. And this is over the counter. So this is by the National Institute of Health, and they've stated that, of course, naloxone rapidly reverses an opioid overdose. And the way they do that, and this is something that I learned through medical school and a lot of my training, is that there's certain there's certain agents that actually block the effect of opioids, and one of those is naloxone. This attaches to the receptor so that the effect is not harmful, and the effect of an opioid overdose can be reversed. Without this medication, a lot of overdose would result in death. What are some opioids that we struggle with as a society? Heroin, fentanyl, oxycodone, hydrocodone, codeine, and morphine. Some of the symptoms, if their breathing has slowed or stopped because of an opioid overdose, then this can be quickly reversed by the administration of naloxone. How is naloxone given? This is injected into the muscle. It can be nasal spray. It can be administered under the skin or into the veins. So this then goes into the various administration systems. Can I give naloxone to someone who has overdosed? Yes. And people should still call 911 immediately in the event of an overdose. Naloxone is being used more by police officers, and so this is a reversal in policy, in that no longer is this is this incriminating people. This is more allowing people to get off of some of the addictive drugs. There's some precautions that you would need to take. Reversing opioid overdose in the body for only 30 to 60 minutes. That's the amount of time that naloxone works. So even afterwards, when the effect wears off, the effects of an overdose after a dose of naloxone wears off. People who are given naloxone should be observed constantly until emergency care arrives. And then the physical dependence on opioids may have withdrawal symptoms within minutes after they're given naloxone. And what are these withdrawal symptoms that you look for? Well, some might include headaches, changes in blood pressure, rapid heart rate, sweating, nausea, vomiting, and tremors. Of course, the risk of death for someone overdosing on opioids is worse than the risk of having a bad reaction to naloxone. So that's another aspect to pay attention to. And then this goes into a tolerance versus dependence versus addiction that you might want to go over. What is the cost of naloxone? Well, it depends on how you get it and what type you get. People with insurance should check with their insurance company. Patients without insurance can check the retail costs at the local pharmacies. Where are they being? Where can you receive naloxone and buy them? Well, pharmacies carry naloxone, and then in some states, you can actually get naloxone from a pharmacist, even if your doctor did not write a prescription. Um, and this is on a community-based distribution program. Um, so, co-prescribing naloxone with prescription opioid, um, this may reduce the risk of opioid-related emergency room visits. So this is a summary of what I've just talked about. I hope this has made some sense. Thank you for listening.